Good evening, everyone. I am Dr. Denise Seigart at East Stroudsburg University, and I'm very pleased to be participating in your webinar. I'll be presenting on simulation to support education. I am currently the Dean of the College of Health Sciences at East Stroudsburg University, and we're using simulation in a lot of our programs, so it's a very good topic to be speaking about. I also want to say hello to all my friends at Volgograd University. I miss you very much, and I hope to get there to spend some time with you very soon. I'll also be sending the PowerPoint so that you can follow along on the PowerPoint as well. So simulation in education has become much more popular recently. And of course, some programs have been using simulation for a long time, like medical education. But we're starting to see it being utilized in a lot more educational programs. Nursing, for example, has recently implemented simulation, and I have other programs in my college like exercise science and athletic training, which are also looking to utilize more simulation in their programs. So simulation refers to the creation of real-world activities and processes in a safe, virtual environment. Simulations try to provide an experience as close to the real world as possible. However, a simulated activity has the advantage of allowing learners to make mistakes and to try again and do a do-over, so to speak. Simulation can involve standardized patients, so live patients, computerized case scenarios, mannequins, clinical vignettes, or some combination of these methods. And it's being utilized in education for practice, and it's also being utilized in testing. And we're also beginning to see it being implemented more in the statewide testing for licensure. So nurses, for example, may eventually have to do some simulations as part of their licensing exam. Now, we have seen through research that simulation can lead to what's called deep learning. It has the potential to engage students at a higher level as opposed to just memorization or what we call surface learning. A good summary of how deep learning contrasts with surface learning is in a reference that I will provide for you in the PowerPoint, and I would encourage you to take a look at that. There are different types of simulation, and depending on what it is you want to do, you can consider any of these types or combinations of them. We refer to them as high fidelity, low fidelity, standardized patients, or instructional simulations with virtual reality. So high fidelity usually refers to fairly expensive mannequins, complex scenarios using very complicated computerized programs. So for example, you might spend $200,000 on a very sophisticated mannequin that has a lot of computerized activity. You can change the scenarios so the patient could have a cardiac arrest, for example, and then the students would be responsible for caring for that patient. Low fidelity simulations are more simple cases, and they might be referred to as task trainers, for example. So we have IV arms, for example, where a student might be given the task of starting an IV in this mannequin arm, and they can be fairly sophisticated in that they have blood, and so when the student starts the IV they get a blood return, but they're still pretty simple in their functioning. They're not computerized in any way, and often used for very specific tasks. Standardized patients can also be used in simulations. These are usually live actors or community members who have been trained to act in a certain way in a scenario, and they can respond to questions, and they can question their nurses or doctors or athletic trainers or whoever it is that's in the simulation. Some people would refer to this as high fidelity because it's very engaging and can be very complex. Other types of instructional simulations can include computerized games, virtual reality scenarios where you're interacting kind of with an avatar, or even very simplistic case scenarios that are on paper and you just have them do group work. So an effective instructional simulation requires a few things. It usually requires some fairly intensive lesson preparation on the part of the faculty member, often writing scripts to follow, lots of information for the students so that they can prepare for the scenario and things like that. It also requires very active student engagement. So you want the students to be able to do a lot of problem solving and to be able to use the skills that they have learned in a very engaging type of environment. And then one of the most important things about simulation is the reflective period after the simulation, the guided discussion that the instructor does with the students in order to allow them to what we call debrief, so that they can reflect on what happened during the simulation, what they did right, what they did wrong, what they might do differently. And some research has made the argument that this is the most important part of any simulation. Now, we also know that in order to have effective learning, 3 conditions are generally present: repetitive practice, integration into the curriculum, and provision of feedback, as we said, debriefing. So the repetitive practice means that the students have to have the opportunity to do this more than once. And the more times they do it, the better they will become, particularly at psychomotor tasks, starting IVs, things like that. So for nursing, it's very important that they do this repeatedly. It's also important that we not use simulation as kind of an isolated event. You want these to be integrated into your curriculum so that you're using them on a regular basis, and students become very comfortable with using simulation as part of their educational program. And then, of course, the debriefing, as I said, leads to very deep learning. We know that simulation should encourage the transfer of knowledge, promotes deep understanding, promotes understanding of social processes. So we can integrate, for example, communication patterns and practice of communication patterns. We can integrate some factors like poverty into the simulation so that the case scenario would integrate some of those social factors that can lead to problems that the students then have to solve. And of course, as I mentioned, we want the students and the instructors to be very actively engaged together in the simulation. Now, at East Stroudsburg and in our region, we have a variety of programs and people that are using simulation. We have a poverty simulation, for example, that we run once a year with close to 100 students. This is a very interesting simulation where they are given a role to play within the simulation, and then they act out that role. So they might be, for example, an individual who has just gotten out of jail and they can't find a job, and they are trying to get some money so they have a place to live, and it gives them these very rich histories, and all the students in the simulation are given a role to play. Some of them are social workers, some of them are nurses, some of them are, just getting out of jail. Some of them are children that their parents are not providing care for them. And we do this once a year, and we have really good results with that. You'll also see students in our accounting or economics programs, for example, doing simulations where they're creating a market and then watching how that market behaves depending on different case scenarios. We have students who play party delegates in a political system, and then they run a convention or they run an election or something like that, and they do a simulation around how that process happens and different scenarios that can come out of that. And of course, you might also see in the region airline pilots practicing landing a plane via simulation, or electrical engineers practicing checking load requirements in a building via simulation. So there's all different kinds of simulations that can be used in various programs. I had an experience myself with simulation when I attended a leadership development program at the Wharton Business School at the University of Pennsylvania. And so there was a group of us in this leadership training that were given a case scenario that involved a racetrack. And we were told to make a decision as to whether or not this racetrack, this car that we had on this racetrack, was going to be allowed to race. And there were a lot of factors involved: the cold weather, there was a lot of money invested in this car, and if we didn't race the car, we were going to lose a lot of money. But the cold weather was affecting the running of the car and the engine and the tires, and so there was a risk to the driver if we were to allow the car to run in this cold weather. And we had been advised by different people not to let the race go on with this car, but then other people, some of our upper level managers, were saying, no, it'll be fine, you have to let this car run because we're going to lose a lot of money. And so our group decided it wasn't worth the risk, and we decided not to let the car race. And after the scenario was done, the individuals who were running this leadership scenario told us that they had changed the scenario to a race car, but what we were actually deciding was whether or not the shuttle should go up. And that was the shuttle that exploded. So I was really glad that I had decided not to let that race car go out on the racetrack. So our shuttle did not explode. We were really happy about that. But it was such an interesting simulation scenario to participate in, and it really brought home for me the importance of simulation in education. The other simulation that you may have heard about is when the pilot Sully practiced flying a plane into a river. You know, airline pilots don't get to land on water or in rivers every day, probably never. But they do practice that through simulation. And because he practiced that, then he was able to land that plane in the Hudson River. And he saved all those people by landing that plane that had lost its engines in the Hudson River. So it really brings home the value of simulation, particularly in situations where it's an event that you're not going to be able to easily practice. In nursing, we do these simulations in particular with situations where we're not going to be able to practice. So maybe a cardiac arrest, for example, or a baby being born with a significant problem. These are the kinds of things that we can run simulations, and the students get to practice this without perhaps actually seeing it in real life. There's also been a fair amount of research into the value of simulation for practice on particular tasks. In the PowerPoint, I provide you with an example of a medical program where students practice the insertion of central venous catheters, and they were trying to reduce the incidence of infection through that insertion. And what they found in this research study is that those medical residents who went through this simulation training program had a lower infection rate than those that did not. So there are lots of examples of this in the research, and I would encourage you to take a look at it. I've also provided for you some of the references that I have used in the preparation of this video and this lecture, but there's lots of information out there on simulation. I would encourage you to take a look at it and certainly learn more about it. We have been really impressed with what we're able to do at East Stroudsburg, and we're expanding it into many more of our programs, and I hope that you will have find value in this as well. So have a great day, and it's been a pleasure speaking with you, and I hope to see you soon.